just in time.
Okay. Hello, everyone. Welcome to All Things Odd. I had to go answer the door for FedEx, so that's why I was running back in. But welcome to the show. I'm going to let Dr. Hannah Galloway talk a little bit more about what we're doing. So I'm Dr. Phillips.
I'm Dr. Hannah Galloway.
And I'm Trista Hauser-Smith.
Yes, and so today is exciting. We have some guests, which we always like to have guests on the show so we can learn about new things. And they're actually from Hearing Charities of America. So I definitely learned a lot about their program just by kind of looking at their website. And I think that they can be super helpful to both patients and providers. So we just kind of wanted to give you some more information about them.
Awesome. So we're going to bring them in. And who we have here today is Taylor Dunlop and Brooklyn Pruder. So welcome. Taylor is a hearing aid project manager, and Brooklyn is the hearing aid project administrator for Hearing Charities of America. So I'm not too sure, as people are coming in, let us know if you are aware of Hearing Charities of America, because it was definitely something new to all of us. I know that we've got some different resources, but this is something that we wanted to share with everybody, whether you are somebody that is watching that might need to know a little bit more about where you can get options for hearing aids, or as a provider, we wanted to make sure that you guys knew about Hearing Charities of America. So we're going to start with just having them talk a little bit more about what Hearing Charities of America is about, such as maybe, how long has this charity been around? What inspired the creation of the charity, and what else can you share with us? So welcome to the show.
Thank you. Thanks. Yeah, so the Hearing Aid Project is the Hearing Charities of America's primary program, and it launched in 2016. It was designed to basically, very simply, provide hearing aids to people who can't afford them. They're an expensive healthcare cost that you don't think about till you need it, really. And so we launched that in effort to kind of try to bridge that health discrepancy.
Mm-hmm. Awesome. And what are some of the goals of the charity, or the project, should we say?
So really the primary one is to connect low-income individuals with not only the hearing aids, but with the licensed professional who's able to provide, in some cases, that audiogram to diagnose the hearing loss, and then also to provide that professional fitting of the hearing aids once they're approved for the assistance.
Awesome. Okay. For people that are, interested in becoming involved, let's say we're going to kind of walk through this from the patient perspective as well as the provider perspective down the line. But in what ways can you be involved in this charity, just as part of the community? If a part of the community that isn't a patient or provider wants to learn a little bit more about it and be a part of it.
As far as the general community, what we really want from people is to spread the word about us, and also donate any hearing aids and anything really related to hearing aids at all. We accept batteries, cleaning tools, any hearing aid related accessories, chargers, just everything. And anything that we can't necessarily refurbish and repurpose for patients, we can still use parts. So we accept it all. And that's something unique, I think, to our charity.
Is it easy to have people just donate to you directly, like on the website, or do they need to go into a hearing healthcare provider to donate there and get forms or anything like that for tax donations?
Either way is fine with us. Most people just directly send a package to our office, and then we process it here. But we also have collection centers all over the country that collect hearing aids and then send them to us in bulk. But every single person who donates does get a letter for tax purposes, just acknowledging their donation.
Got it. Hannah, are you able to put up the website?
Yeah, so
that way we can kind of look and see.
Website here. And so you can see, let me try to scroll through. There's some links here so you can give your hearing aids help, get hearing aids, and yeah, it looks pretty straightforward as far as what you need to do here.
Mm-hmm.
Awesome. Okay. So I'm going to let maybe Trista talk about it, some questions that we have from the patient perspective.
Sure.
So as far as from the patient perspective, maybe a patient has some hearing aids already and they've kind of updated their amplification and they're just not using the other set, would there be any type of manufacturer, any type of aid, age restrictions on any of the hearing aids, or do you kind of take just everything?
Go ahead.
Okay. You mean as a donation?
Yeah.
Okay, yes. So yes, we do provide the hearing aids that we fit individuals with are the 6 major brands, which is Phonak, Signia, Starkey, Oticon, Resound, and Widex. But if it's, for example, a Kirkland or something like that, we'll definitely take it. And we can use those recycled parts from those hearing aids to either fund the refurbishment process of the newer ones that we give out or for their parts like Brooklyn mentioned.
Yeah, and I do want to mention we take custom in-the-ear hearing aids too. Those aren't going to be used, of course, for patients who qualify for a program, but again, we can use those for parts, and that does help with our program.
Okay. And what do you do with those parts and pieces? Are you giving out those hearing aids to other providers, or are you setting up times where patients can come in and pick them up or take them to somebody else? How does that process work?
Yeah, so we work with Starkey Labs, and we have a agreement with them that we send them kind of our older hearing aids, and we have a partnership there. Sometimes we also work with like universities, for example, who go on medical mission trips, and we give them some of our older hearing aids. So really everything does go to use for sure.
Awesome.
Are there any stipulations, like who can apply for the program as far as the patient goes? In Colorado, we have expanded Medicaid, which is great, but Medicaid doesn't pay for hearing aids for adults. And if I remember correctly from interning in Kansas, they don't pay for hearing aids for like anybody. So,
Correct. Yes.
I remember I did an internship at Children's Mercy. And so,
Yeah.
They're a really awesome organization, and they actually just internally fund all of those kids' hearing aids. But we find this gap, of patients who can't afford something out of pocket. They're really motivated, but they're usually, kind of on a limited income. So are there any, people that can't apply for the program, or how is that sort of doled out?
So short answer is no. Anybody can apply, any age, no matter where you're at in the country, any income level, really. We encourage everybody to apply because who knows, if you're eligible. And really the primary requirement that we look at is that financial need, location and everything else is kind of falls by the wayside. So as long as they have that financial need, they'll most likely qualify for the program.
Okay, awesome.
With the devices that are fit, like for the recipients, what does it come with? What kind of warranty does it come with? And what happens if they were to lose or damage their devices that they do receive?
So, so we do have a 1-year replacement warranty. If something happens that the hearing aids we originally send don't work, we'll replace it. We'll just send a new inventory over to the provider, I should say, the audiologist, no questions asked, and replace that for them. And other than that, we can also, a lot of our hearing aids, since they're newer now, they are covered under manufacturer warranty still. So they can be actually sent there for minor repairs as well.
Oh, wow. Okay. All right. So we also have some questions kind of from the provider perspective, because a lot of our show is being shared into groups that have other audiology providers, hearing healthcare professionals. And so we have just some questions as well for them to get involved. But what do you need from providers, or I guess, if they want to get involved with this project, are there any requirements to participate? Like, do they have to have a license, certification, anything like that? And how do they apply?
Yeah, there's 3 main requirements we ask for from audiologists. First is proof of licensure. We definitely want to make sure we have qualified providers working with our patients. We also ask for a copy of malpractice insurance just to make sure we're all good there. And then last, we would like to work with providers who have at least been working for 2 years. So we ask for a CV or resume to just determine that part. Then finally, there is an agreement between us and the audiologist, so we both know what we're doing for each other.
Okay. So Hannah, can we pull up that website again? And is that where the website that we had pulled up there, is that where they go and apply? Or is this mostly this project website here is for recipients?
So actually, it's pretty new, but under Help Others, there's actually a link called or titled Audiologists Making a Difference. And they can,
Oh, yeah.
well, it might be on the drop down before, like, don't click on, yeah.
Oh, there we go.
And then, so there they can read kind of what we've described a lot of the requirements on the documents, some of the benefits to them of participating. And then even towards the bottom, there's a place for them to upload those documents that we ask for.
Nice.
To make it as
Okay.
easy as possible.
Okay, so that's where audiologists would go. And is it audiologists and hearing aid dispensers?
So we do primarily try to work with only licensed audiologists,
Okay.
but we do allow, I guess I should say, hearing instrument specialists and dispensers along with audiology students to fit as long as they're covered under that liability malpractice insurance.
Okay,
And
got it.
there has been a few times in the past where we've made a few exceptions to if we're working with a really rural community or even, and there's not, a lot of resources, or even a patient who has a very long and established relationship with a hearing aid dispenser or instrument specialist, then we'll kind of case by case, we'll be able to make some exceptions in that. But we do try to work with licensed audiologists primarily.
Okay, good to know. And then, sorry, Hannah, pull that up again, and then let's look and find where recipients can go and apply as well.
So that was back on this previous page. So this was just the main page. And it looks like we've got get hearing aids, give hearing aids.
Okay, perfect.
So I'll go ahead and go to get. And then it looks like, yep, so qualifications here, resources. I love that you guys have the VA on here because that a lot of veterans don't know that they may be eligible for hearing aids through the VA. So that's really awesome. Let's see.
Absolutely.
There's the application.
Nice. Yeah, so it looks pretty easy.
Mm-hmm.
Okay, great. Yeah, no, this is a great site. So it's the Hearing Aid Project. Okay. And one of our colleagues jumped on. He is an audiologist out in California. And there's a comment here. And he says, this is great. Definitely we'll look into this. Yeah, I honestly think that some of our colleagues and audiologists don't know about it. He's got a question here. Can you post that up, Hannah?
Yes.
So he's got a question for you guys, and it basically says, to be listed as a site under the Get an Aid, do we need to have a 501c3 or nonprofit setup?
Actually, yes. All of the organizations that we partner with like that and that we post on our site, they do have to have a nonprofit status. Yes.
Oh, okay.
But we can partner, with audiologists, even if, universities, private clinics, all of that through the Hearing Aid Project. But yeah, to list as a partner of ours and kind of have that back and forth. Yeah, we partner with nonprofits.
Okay. Which kind of, go ahead. Sorry,
I was
Brooklyn.
going to say, we also provide a little logo that clinics can put on their website to also let people know that they are partnering with us.
Okay, awesome. Which kind of leads us into another question. What are the benefits for audiologists to participate with you?
So the main one I would say is that they can refer to any of their low-income patients to the program at any time. There's no cap, no limit on how many people they can refer to us. And so, yeah, that's, I think, is a huge benefit. And other than that, I would say just that kind of knowledge within their communities that they're interested in giving back and making sure that people are taken care of, I think is a huge benefit too.
Yeah. Yeah. So having a resource for patients is always a great benefit, right? And then, as far as now fitting the hearing aids that are coming from you, once an audiologist is a network, how often do you see referrals come their way to be fit? And is there a timeline? I know that we work with a hearing aid bank here as well, but there's kind of a timeline that we verbally say, hey, we will only take, this certain amount or whatever every month, or, is that something that can be customized, or what would you see would be part of the patient flow for clinics that want to be in network and participate with this?
I think that's another great benefit of our program. The power is totally in the audiologist's hands. If they only want to see one patient a year, that's fine. they want to see 10, that's also great. It's totally up to them. And when we sign that provider agreement, they can kind of determine, okay, I only want to see at max 4 patients this year or whatever. So, and it also kind of depends on the area of the country, how many patients we have there who are interested. So.
How many providers do you have? Are you able to estimate, like in the US?
I don't know.
I mean, over 100. I would say like right over 100, and that's private combined with university clinics.
Okay.
I would say so. And while that's great, and we've built it a lot in the last year that Brooklyn and I have been here, we definitely need much more to serve, the entire continental United States the way that we actually want to.
Yeah.
Yeah.
Do you guys just have hearing aids like lying around ready to go then, and you're just looking for more providers to get on board?
We have piles and piles and piles of hearing aids. And boxes and boxes sent from all over the country. It's pretty insane.
That's great.
Like we mentioned earlier, not every single one is usable for patients, but we do get a lot of really good quality, almost brand new hearing aids that are ready to be used for patients. And what we really, really need is audiologists to get involved, because we get calls every single day from patients who desperately need hearing aids but just can't afford them.
Wow.
And yeah, what we need is the audiologist to fit them.
Awesome.
I think
Well, hopefully
our
this
show
will
is a
go
good
out.
outlet for that. Hopefully there's lots of audiologists all over the country that kind of watch. And I went to the University of Kansas, and we had a speech communication camp every summer that through the department that was sponsored by Sertoma. And so I don't know how you guys are or are not affiliated with Sertoma, but I was surprised that I didn't know about your organization, like working in Kansas City. I mean, I left there a little bit before 2016. But it's awesome to know that this is like a Midwest program, and we do tend to see those gaps in the Midwest states and insurance and that kind of thing. Colorado's pretty progressive, but still, that doesn't provide hearing aids for adults. So
Right.
Yeah. And sorry, Sertoma is our partner charity. So Brooklyn and I do work for both. Technically, it's so they're very closely connected. Yeah.
Awesome.
Okay, so we're calling all of our friends. We have a lot of people that, know us. And so we're calling on our friends to get involved because it sounds like there's a need. Brooklyn and Taylor, did you guys start reaching out to universities first? And now you're kind of like getting out into private practice clinics, things like that, just because of who comes to universities that might be more needed and the resources there?
Honestly, yeah, we did start and focus on universities for a long time, just because in a way they automatically understood what we were trying to do. And so they were quick to want to get involved. And it does add a certain legitimacy to like patients know that they're going to go and get quality care and all of that. So that is, the more universities, the better. Yeah. We're still trying to focus on that too.
Awesome. Yeah. Yeah. We definitely know people that are watching or watch the replay. And so we're hoping that people get involved a little bit more here. How many donated hearing aids? You said you have boxes and boxes, how many donated hearing aids do you actually get in a year? Can you estimate that as well?
I mean, boxes, sometimes we'll get a donation from a clinic that has 100 hearing aids in it. And then other boxes will have 1.5,
Right.
Yeah. It varies a lot. COVID had a huge huge contribution, I should say, to kind of that flow of hearing aids that we got for a while. So, I mean, it would be really, really hard to put an actual number on that.
Yeah.
Do you guys know how many patients have applied through the program and gotten hearing aids? I don't know. We didn't ask about any of these numbers. I was just curious, since it's been since 2016. Are you guys seeing like an uptick in how many you give out each year as you grow?
Absolutely. Yeah. Since the fruition of the program, it has steadily been increasing as the years go on. And we are very unique. The whole program itself, there's not very many programs like this in the country. So as people learn about it, we'll get more and more applicants, and fingers crossed, more and more audiologists, and it just gets bigger and bigger. Yeah, all the time.
So I have a question, and I'm trying to figure out if it can be done. But let's say like we want to do an event at Audiology Center of Northern Colorado, right? And we start collecting names of people who can't afford, the technology, and they. If we send them to another funding source, that could be backlogged or whatever. So let's say we collect names of at least, I don't know, 5 to 10 people that would need that. And we decide to have an event that would be on a Saturday, and our staff would come in, or maybe patients alongside would want to, fit that. Would we be able to kind of coordinate something like that where they all apply? We can all say, hey, this is the date that we're going to do it, where it's actually going to be an event. And then we get everything all ready. Would that be something that can be done through this project?
Absolutely. Yes, that would be great. Especially whenever we have audiologists actually refer their patients to us and they're already in our network, it is a very quick process. We can process applications very, very quickly. It's really just that search for someone who's willing and able to fit them at the time. So if you had the patients ready and you were going to be fitting them, oh yeah, easily. We would love to do that.
That would make our job very easy.
Yeah.
Well, and if you think about it too, just from, I'm thinking of it from a private practice standpoint too, having like one set day and you really fit all of them in one day really wouldn't take up too much of your time, especially if you do it like on a Saturday or something like that, right?
Well, yeah, if you're not seeing patients on Saturday, you're not limiting your income or anything. And it would also be easier for us to get 5 pairs of hearing aids, get them all set up. We already have the patients lined up, and then fit them all in one day. We could even, like triage, where one person fits and one person counsels and one person, does orientation or something. I think that's a great idea.
Yeah. And then make an event out of it. And sometimes I remember some of our previous patients are like, hey, if you're ever going to do that, I would like to serve alongside with you. And that's really getting the community involved, maybe even going to a local business that is a restaurant and say, hey, this is what we're doing as an event. Would you be able to donate refreshments or whatever? We can put your sign out there, but it's really, giving back as a community and getting people involved together. Right. And so it would be a whole day where we just dedicate to that too. So if you're listening, if you guys have any other ideas, put it in the comments too for people that are coming back to watch this, whether it's right now we're streaming on YouTube and Facebook. So if you have comments, put it there. I know it's going to be on our Instagram as well. I do believe that Brooklyn and Taylor Sotoma is probably watching and putting it out there. So if anybody has any comments or suggestions of how to really help this along, then please add it to that, because every little thing helps to get people thinking about it in a different way, I think, so that you don't have to say, ugh, yeah, but I'm in a private practice and I don't want to waste my time, or I don't want to do this, or, but maybe think of outside the box a little bit and figure out how you can get other people in the community involved. And it'll be a lot easier and actually more fun too. I can pick patients off the top of my head that I know that if we say we're going to do an event, they'll show up and they'll empty the trash, or they'll do anything to be around, right? To help out in any way, or maybe say, hey, I'll go pick up the food for you guys so you don't have to worry about that, or whatever it is. Just getting people involved. And I think that makes it kind of fun as well. So,
well, and we do a lot of mission trips in our office. And so we have, pictures of all of that up. And I've had so many patients just say, is there a link where I can donate, to your mission funding? Maybe they're, blessed enough to be able to buy themselves the best technology, and they just see how devastating it would be to not have access to that. And so I've had patients ask, and I think a lot of patients, as great as it is to donate, to a mission abroad, I think a lot of patients would love to keep something like that here in the community.
Yeah.
And I'm just going to say, because I think we're really interested in doing this, and I can already, think of a couple patients off the top of my head, but Natalie, I think we could totally help other clinics, come up with sort of a day of how to, sort of like a schedule of events, or what we did and how we plan it. To make it a little easier for other people to execute on a Saturday at a private practice, so they don't have to worry about interrupting their business flow.
Yeah, I'm getting chills because I'm like, yes, we would type up a protocol, give it to you guys. And so if there's a clinic that's involved and they're like, what if we want to do this? We're like, well, we had a clinic who did this, and here's the checklist of what you need to do, and it probably would help you guys out too, which is kind of interesting, because this takes us to like kind of our last question, but if we can pull up that website one more time, because really it's about donations. So you can donate hearing aids, but you can also donate funds, right? But we want to make sure that we cover everything that you guys might need. We talked about donation of your time, obviously, for professionals to get involved, right? But what else? What other kinds of help besides, I don't know if I've covered everything from funds, hearing aids, definitely need the professional side of it. What else do you need to help push the needle forward to really get people to learn about this? I mean, if you're watching this, share this live stream out, or it's so easy. If somebody's watching right now, type in the comments right now that website so people can just click on it right now. Or Hannah can put it in the comments as well. But, it's something that hopefully, we can get people to share out. But is there anything else, Brooklyn and Taylor, that can help push the needle forward for you guys?
I mean, honestly, I think you covered pretty much all of it. The professional side and then word of mouth, really, like you just mentioned, is huge. And the more people, it's more of a common thing, concept and organization. Hannah, like you said, you were here and you hadn't really heard enough about it really to know. And so, yeah, word of mouth is huge. Funds, like you said, that's always helpful. And yeah, go ahead.
I think the one thing we didn't cover, I guess, is we have some people start collection centers across the country. So a lot of times that is just audiology clinics themselves setting out brochures in the collection box, but it's also just individuals in the community. Sometimes they reach out to their local nursing home and ask if they want to set up a donation center. So that's another way that members of the community and audiologists could get involved as well.
That's awesome. That's a great idea too. Yeah, I just had somebody that walked in with very old custom ones, and he's like, I don't know what to do with these. And I said, yeah, usually you can donate them somewhere, but we didn't have a collection box ready. So I know that. I'm so glad that both Hannah and I are on, plus our student, because it's like, oh, we've got projects to do now. Sign up to be a provider, get all that information in, and then also maybe do a collection box, right? Or maybe even have a little list of names that we would start gathering to maybe start to do the event. So there's so many different things that have sparked because of our conversation today. So we thank you guys so much. Hannah or Trista, do you have anything else? Any questions at all, or anything that's on the top of your mind before we end?
The time of this is perfect because I know for us, we are a newer clinic, but during COVID, we sort of had this void because there was a manufacturer who was giving brand new hearing aids out to people who were low income. And we were, it was kind of the same as your charity where we, donate our time to fit the instruments, but they provide the instruments, and they actually ceased that program. So I know at least for us, there is this population of people that we can't serve and we hate it. Because we strictly need devices. I'm totally willing to donate my time. It's just, being able to, the devices are expensive and, getting them checked out and make sure that they work. It's just because somebody gives you an old hearing aid doesn't necessarily mean we can just fit it on somebody. So, I think this will be great for us. And I can see a lot of other audiologists that probably have the same need as us if they don't work in a hospital that can provide funds or, a greater system that has those resources.
Yeah, this has been great. Well, thank you guys so much. We have your contact information. So people that are watching this show, they can either reach out to us by direct message, or we can get you connected to both Brooklyn and to Taylor, and to learn a little bit more about the Hearing Aid Project and about Hearing Charities of America as well. So hopefully this got some people interested, but thank you for being part of our Philanthropy Corner on our show. And if we get anything else, we will pass it on to you to get people involved.
Yeah, maybe we can do an update too. After we have said event, we can do an update on how great it went.
Absolutely. That sounds awesome. Yeah.
Thank you so much for having us, guys. This is really great.
You're welcome. It's definitely a win-win for everyone involved. So we thank you guys for your time. All right. With that, we will be back next week, same time, 12:30 p.m. Mountain Standard Time, on an all new episode of All Things Odd. So we'll see you then. All right.
Thanks.
Bye.
Bye.